Hey everyone, Irene here, and welcome to this entire world of nervous system health and healing. And today I have a special topic lecture. This is a rerun of a bonus event I did just a little while ago. The topic is why biohacks do not work for nervous system health. We could also say for nervous system regulation, for gaining self-regulation. This is a very important topic right now because there are so many out there who are trying to hack. They're trying to get the quick fix to restore nervous system regulation to their system. And there's some troubles with this. And I get into this in this chat, in this talk. Also, during this lecture and discussion, we were in the process of registration for my program, Smart Body, Smart Mind. This registration is now closed. We will open up again in the next year, in 2023. I will date this. And the reason why this is so important to me is because my team, lots of messages from folks who have tried to hack. They have tried to go the quick fix route to restore regulation to their nervous system, and often it does not end up well. We have to remember that as humans, it took us time when we were little to gain self-regulation. And if we did not get that strong, solid foundation, we have to build that up as adults in a very foundational, sequential, consistent manner. Biohacks do not work for nervous system regulation. So check out this lecture. I mentioned the registration of Smart Body, Smart Mind because I am mentioning that and answering questions along this lecture journey. So there's a lot here. It is a little longer, and I have no doubt that you will learn a lot and understand, I hope, a little bit more why we do not want to biohack the nervous system.
All right, everyone. So welcome. My name's Irene Lyon, and I will date this. It is the 14th of September, 2022. And I am today going to talk about a topic that is near and dear to my heart. It's become more near and dear over the last couple of years. The title technically is why biohacks don't work for nervous system healing, or we could say for healing trauma, for restoring regulation to the nervous system. And I'm going to break down what biohacks mean to me, and I'll throw out some examples throughout the talk today. For me personally and professionally, what I've been seeing as I move through this world of healing trauma and the nervous system, and I have been in this world for quite a while. I realize some of you are new to me, so quick note, I have been in the world of helping and healing, working with humans since 1996. When I was in university, I studied fitness, exercise science, biomedical science. I have 2 degrees, a bachelor's and a master's of research. That was my early years, my 20s. Then I had some really significant injuries and surgeries as a result of my athletic sport. I won't get into all of it now. It is on the bio on my site if you want to check that out after. But I was trying to recover in my 20s from these surgeries and injuries, and something wasn't working. I wasn't getting better. I wasn't getting stronger, yes, but I was in a lot of pain. And I was trying to do the general way of working with physical therapy, massage, chiro, and something just wasn't working. In many ways, you could say I was trying to hack my system then by directing specific areas of my body and working on specific areas of my body that were tight or in pain, when really what was happening was my entire organism was still stuck in a bit of a trauma response. It was still stuck in a bit of a confusion from these injuries. And I had to literally relearn how to move again. I was moving and I was able, but the nervous system wires were kind of at cross purposes. So that is what led me and literally threw me into the world of mind, body, neuroplastic healing learning through something called the Feldenkrais method. And then from there, started private practice, and then realized we're missing another piece. The Feldenkrais work was not enough, although it is brilliant work and beautiful, and I bring it into all my work. the trauma piece came up. And some of you know of Peter Levine. Hopefully some of you have heard of him, somatic experiencing founder. I came across that work in 2007, 8-ish, and it just blew my mind. And I had all these ahas. And why haven't I known this until now? And of course, it's because the work was still fairly new to the world back in 08. We've really come leaps and bounds since then, which is so great. But getting into that work was eye-opening, to say the least, because I now realize, and then I realized, wow, this is really the missing link, right? This is the missing link to how we work with ourselves and heal ourselves. So let's just say, I'm going to put you into an imagination. Let's say someone wants to train or wants to, I just gave away the answer. Somebody wants to summit a mountain. And let's pick Everest because it's, the tallest one on planet Earth in Nepal, in the Himalaya. Someone wants to summit Everest. That's their goal. Would they be able to do that quickly? Would they be able to train for that quickly? Say a person had never done any exercise in their life other than maybe walking to the grocery store and walking their dog. In the chat, let me know. I know this seems like kind of an obvious question, but I just want to get us all on the same page. No, yeah, there's no way. Even myself, who has fairly good fitness, if you were to put me at base camp and ask me to go for a walk for an hour, I would be hurting. I know that because I'm not conditioned to be in that high altitude. So there's low oxygen, just all of that. So no. If I think back to my world of fitness and being in that world, there were many people that came in and they wanted the quick fix, right? They wanted the biohack. They wanted to get strong really quickly. And we still see it. Do you ever see those magazines? Do you ever see magazines still at the grocery store? And they have the little headlines, 6 ways to get tight this and 7 ways to lose 30 pounds in 3 days and 10 ways to have, the best sex ever and one, all these little things. So in some ways, humans, we are wired to want the quick way. I'm not sure why that is. Someone should do a PhD study on that, but for whatever reason, we want the quick fix. And I understand that. So if we change gears to this trauma piece, and I realize some of you are new here, but I'll try to lay the foundation here first. So I'm going to do a little nervous system education 101. We have a nervous system. We have this autonomic nervous system, and this autonomic nervous system governs our digestion, our immune system, our hormones, our circulation, our heart rate, our blood pressure, everything. It also governs our ability to engage. I can see who's here. I can see people that are maybe writing, looking at the chat. They're chilling, different positions. So I'm engaging and you're hopefully engaging with me and hearing, and maybe you nod as I nod and all these sorts of things. So that is also part of our nervous system, this ability to engage and to attune to the world of people and the environment. The other thing the nervous system is important for and does is survival. So if you, I used this example the other day, but we'll use it again. If you're on a soccer field or a football field and a ball is coming towards your head and you see it, what are you going to do if you're not good at catching it? If you're not someone skilled at catching the ball, what might you do? Yeah, I just saw Caroline. You're gonna protect your brain essentially, and it's probably going to happen spontaneously. Yeah, just like if you're chopping onions at your kitchen counter, and you're wearing flip-flops or just socks or bare feet, and the knife falls to the ground. What are you going to do? You're probably going to jump back, right? That's automatic. So this fight flight we need it so that we preserve ourselves. Now, what's the third F? From some of my students who have been around for a while, we have fight, flight, so protection, We might see something not good. We might run. So that's flight, freeze, fight, flight, freeze. So let's say, I'm going to use this kitchen example. Let's say you're chopping onions. You drop your knife, but you have your toddler at your legs playing in the kitchen. What are you going to do, Mama? Are you going to jump back and crush your little one? Probably not. You're going to probably try to keep that knife from falling, but you might freeze in an effort to protect. Thank you. You had me in my brain there, to protect. So the system will default to what it needs based on the environment. Here's another example. Let's say, and this isn't the nicest one, but it happens to humans. Let's say you're under attack. Someone's attacking you. It could be physical, it could be verbal, emotional, it could be sexual, it could be surgical, where you're in an operating room or a doctor's office and you're literally wanting to get out, but you're being held down. Yeah, these are all forms of how we might get a shock trauma to our body. Your system wants to run. Your system might want to fight, flight, but if it can't break free, it's going to freeze. Your survival mechanism will protect you. So that's a quick way of me going into the nervous system. It governs our survival. It also governs our internal systems. It governs our connection. It governs our ability to rest and digest and repair. Now, here's the next question. I'll bring that toddler back in, or even an infant. When a human comes out and they're brand new and they're babies, what do you think is working and what do you think isn't working in their nervous systems? They have, let's just say full term baby. So full term, their digestion is working, their heart is beating, their kidneys are working, their lungs are working. Their immune system has to get exposed to things for that to build up, but they aren't able to fully walk yet, right? They aren't able to talk. They aren't able to say, hey, Mom, I'm hungry, but they'll cry, right? They'll fuss. They'll have shrieks in their voice to say something isn't feeling right. They don't have, someone said, social engagement. It's primed. So if you have a little baby and you start talking to it, they'll spark up, right? We know this. There's been experiments that have shown if you put a mama and a kid, and they don't do this anymore because it's not ethical, and they have the mom have a still face. This is actually stuff that they used to do, still face experiments. Just look it up. It's pretty hard to watch. The baby will go into distress because she's looking for mama's face. She's looking for mom to connect and say, hello, I'm here, I'm hearing you. And the kiddo will go into severe distress. So when we're born as humans, we have some things working. Our survival responses are working. If a baby hears a loud bang, they startle, right? These sorts of things. So as a new human, we need help. And this, believe it or not, will tie into the biohacking. I'm getting there. I always come full circle. So little one needs to learn from big people or an adult or someone who is more regulated how to be in the world. They essentially are learning how to connect. They need attunement. They need safety. They need to be talked to. They need food when they're hungry, and they need someone to hear that and give them what they need. If they're hot, they need their clothes to be loosened. If they're cold, they need a little bit of warmth, all these things. This process of an older human connecting with a littler human, a little baby, and attuning and being with them and holding them and engaging them with the world, right? What do you do with a kid when we're out? Look at the bird, see the tree. Let's look at, the fish at the aquarium, and we look and we engage. We socially engage, we orient. This is what over time builds this thing called self-regulation of the autonomic nervous system. I'm going to say this again. This attunement, this connection, this engagement, movement. Babies need to move, they need to explore, they need to play. That is building self-regulation. What's interesting is that the human system has so much capacity to get wired into good self-regulation. The clincher is it also can maintain survival and function without good self-regulation. So for many of us, we might have had what we would call poor attachment growing up. We would have had maybe poor attunement from a caregiver, because let's say maybe mom or dad didn't know how to listen to their bodies, so they can't listen to little baby's body, right? That's what we need. When we're born, there's a part of our nervous system. So I'm going to do a little bit more science and biology, and then I'm going to shift gears a little bit. So I want to lay this foundation. When we're born, someone said the social engagement portion of the nervous system isn't working. That is also the portion of our nervous system. It's part of our vagus nerve, parasympathetic nervous system, our vagus nerve. It goes to the heart. Has anybody ever heard of the pacemaker of the heart, the SA node? This is what beats our heart in good pace. A part of our nervous system, this parasympathetic nervous system, this autonomic nervous system, also the vagus nerve, it goes to the heart and it helps down-regulate and calm the heart. So when little baby is being attuned to, and maybe she's fussy and dad holds and makes her safe. Maybe she's cold, maybe she's hungry. Maybe there was a loud bang and it startled her and it led to crying. Dad comes, holds, maybe a bit of movement, connection, touch. He calms down and his calming down calms her down. This is going to build this portion of our vagus nerve that is not built when we are young. This is super important. So if you pick up anything today, this is super important. We need that connection to build this portion of our nervous system, this social engagement system that is more than just facial recognition. It's also going directly to our heart to teach us self-regulation. So keep that in your mind's eye as we keep going, because it's very important. Now, I don't want to lose track because I can go off on tangents. So I've got some notes here. So this early wiring is important to understand the biohacks. And one of the biohacks, and the things that I'm going to mention, they might have a time and a place. Things like trauma release exercises, things like tapping, things like EMDR even, things like making sounds of toning, we would call it, that are known to help stimulate this vagus nerve. Cold exposure is getting really popular right now. Has anybody heard of cold baths? And it's gotten really popular. That has a time and a place. Breath work has become very popular. I actually would consider that also a biohack, but it also can be a lovely practice. But we have to be very nuanced. Is this hack, is this technique, is this trick, is this movement, is this sound, is this electrical stimulation? That's another thing that's becoming quite common, is stimulating the vagus nerve. So that's why I wanted to mention this vagus nerve, that portion of it, the social engagement isn't fully functioning when we're little. We have to engage in order for it to build up. And the fancy word is myelinate. So the ventral vagal nerve is not myelinated. It doesn't have, where's a pen? So our nerves in our bodies, some have a sheath of fat around them called myelin, and it makes the transmission nice and sharp and clean and fast, but also refined. You see what I'm doing with my fingers right now? And I'm going slow. but I could speed up, or I could do these. You can all, and maybe let's play, get into the body. Notice how your hands have this, like you could pretend that you're a Polynesian dancer, even though you may not know what you're doing, right? Or you can pretend that you're typing or you're knitting, or you're fixing something really intricate. We can do this as humans because we have myelination of our nerves. Okay. I'm going to get more sciencey. The portion of our nervous system that puts us into freeze, do you think it's myelinated or not? It's not. It's clunky. It needs us to go fast into shutdown. If we have an accident or a big trauma, we need it to go on fast and clunky and quick. And then this myelination of the vagus that goes to the heart and goes to the face, that is required for nuance. That's required for distinction and differentiation of our human capacities. So I wanted to bring that in because when we're talking about some of the hacks, some of them are stimulating the vagus nerve. The trouble with that is that the vagus nerve isn't the only thing in the human body, right? We have all these other things. And I'm thinking of who here has heard of Gabor Mate? He's got a new book out that's he's everywhere right now called The Myth of Normal. And I fully respect him. He actually literally lives down the street from where my parents live here in Vancouver. And so he's on it with so many things. And years ago, and don't ask me to find where he said this because it was just in passing on a lecture, he said, trying to study and cure cancer. So I'm taking a bit of a sideways analogy here, parallel. Trying to study and cure cancer by researching the cell, like one little cell, is like trying to solve a traffic jam, like on the road in a busy city, by studying the internal combustion engine. In other words, the gasoline-driven engine of our typical cars. You see what he's saying there? Yes, we know something's going wrong, maybe off in the cell, but the cell is not the only part of the human system. It's our experiences, it's our connection with the environment, it's our past capacities of can we self-regulate? And so this biohacking thing is interesting. So I'm going to read something because some of you have maybe heard of something called, let's say, trauma release exercises. This is the work of David Berceli, and I have full respect for him. And I know colleagues who use some of these practices in their existing somatic experiencing practices. So I'm going to just have a little sip here first. Take care of yourselves as we're learning. Move if you have to. I've learned I must drink lots of liquids so I do not cough. All right, so I'm going to read something. And this is a piece excerpted, taken out of one of Berceli's, I think it was an article that I found a while ago. And so he said this in reference to his work called TRE, Trauma Release Exercises. I was living in several countries in Africa and the Mideast that were experiencing war and political violence. I noticed a pattern among all of us that when we became anxious, frightened, or traumatized, our bodies would begin to shake from fear. The shaking had a predictable pattern. It had a beginning at the onset of violence, middle during the violence, and an end. The shaking would stop and the violence ceased and safety was restored. I recognized that the shaking was not a pathology of the fear response, as traditional medicine suggests, but rather it was a healthy mechanism of the nervous system trying to help the body reduce its fear, tension, and anxiety. I developed a method to artificially, I'm going to highlight that word there, artificially evoke this shaking response in a safe and controlled environment. This allows the individual to complete the shaking response long after the stressor is over and reduce the still existing excited charge of the nervous system. So this sounds nice that we could elicit a stored survival response, this fight and flight. But in this context, we need to understand the context. This is in a part of the world, he mentioned Africa and the Middle East, where historically, traditionally, little people and upbringing is very much in connection. It's in community. There is good social engagement. There is this holding of the babies when they're young. There is less medicalization of birth, we would call it, where kiddos are put separate away from their mothers. They're together with their moms. They're learning self-regulation from the get-go. Now, I understand there's always going to be exceptions where this might not happen. But having been in countries, my mother is from the Philippines, so I've spent a lot of time in the little villages in the barrio of the Philippines. You never see a baby cry. You never hear a baby cry. If they're fussy or they're hurt, they might, but babies tend to be very easygoing in these countries. There's even a book, I think, called Why African Babies Don't Cry. I'm paraphrasing this. But there's been research. People have gone in and looked at the differences between babies in what we would call our Western industrialized world, where things are very medical and very sterile, versus in countries where there's just a little more ease and a little more connection. And so the reason I say that, in this instance of war and immediate release of trauma, yes, it makes sense that we might be able to shake out a trauma response in that moment. This is shock trauma that David is talking about here in this example. And the immediate release is happening. But when we transfer ourselves to what we would consider, and I don't even know what the right term is these days, but more Western, more aristocratic, more tight British upper lip, don't feel the emotions. Babies are alone in a, I almost said cage, but crib by themselves. They are left to cry themselves to sleep, which causes dysregulation. And then all these things that we do so that we're basically teaching our little ones to not have good self-regulation. So imagine this, you have an individual that has lived in this more Western lack of connection environment. Fast forward to when they have a shock trauma. Let's say they have a car accident or they have an attack. But their nervous system, I'm going to slow this down a bit, this capacity, this self-regulation, what do you think happens to a person that didn't have that good, safe, connected building of this vagus nerve, of this social engagement nerve that goes to the heart? Let me know in the chat what you think. If someone didn't have that nice, secure, yummy, you're listened to whenever you need needs, and you're allowed to be expressive and cry and be angry and dance and all these things, and then you have an accident that's a shock trauma, we have a very different situation in that kind of individual compared to someone who had the good, connected, attuned, secure upbringing of what we would call, say, being a bit more in that village life, that communal life. So someone said here, re-traumatization, dysregulated and anxious, nervous system disability, spaced out, freeze. So a few things can happen. So what often occurs is a person has this shock trauma, and then they're said, or they are told by, say, a doctor, you should go do some of these trauma release exercises, or maybe go do some EMDR, which is moving with the eyes and shifting things in the brain. Or maybe I've heard meditation is really good. Maybe some meditation will help. Or maybe this, or maybe that. And with all good intention, let's just say the physician has heard through the research that these practices can be good for releasing trauma. So said person goes to a class or goes to a therapist, Again, all good intention. And they start to do this, what we would call technique or hack or individual type of exercise to try to poke the system to release the sympathetic fight flight energy. But little do they know, I'm going to use my cup of water here, got this glass of water. Often the person and often the practitioner doesn't realize that this person's system is full of survival stress. And this person's system isn't able to properly self-regulate because it never learned from the beginning. You are then taking this already dysregulated system who has had a shock trauma, so they're already extra frazzled, and you're basically asking them to release something that their system doesn't know how to compute. But what sometimes happens is the person tries to be the good student or the good patient or the good client. Has anybody ever done this? When they've gone to someone's like me, they go to the class or the person and they don't want to disappoint the therapist or the teacher. And so they override the fact that they want to run out of that office. They can't feel. They've gone numb and they don't realize it. They're dissociating. Or the dentist. Yes. And then you have a situation where a person is in greater dysregulation, greater chaos. And I'm going to give an example because I got this story just a little while ago. Someone had tried some of these exercises on a YouTube video. So they knew, they're like, yep, I have dysregulation. Yep, check. I know I had early trauma. Yep, I knew I didn't get good self-regulation. And so they're learning about the importance of doing somatic work. And so for whatever reason, they found some, we would call them vagal toning exercises on YouTube, where you're doing various deep sounds with your breath, with your larynx, with your pharynx, you're making sound. It is going to stimulate the vagus nerve because of the sound and because of how it connects with the gut. The vagus nerve goes to the gut, but it also goes to the face, the larynx, all these things. This person did these sounds and their system went into a drop of deep depression, which is freeze. And then their system got super cold. Their heart rate dropped, but then they were also feeling overactivated. So if you think about it, what occurred is their system did get stimulated. The vagus nerve definitely got hit with a stimulation, but the system didn't know how to process that stimulation. Is this making sense? I hope this makes sense. And so they then feel terrible because they think they've done something wrong, or they think their body must be so broken because this is what everyone and their dog is doing. So why can't I do it? And it puts you into that shame spiral. And it also can put us into a situation where our system might become unwell. And this is what we also sometimes see when someone's system has this stored survival stress. I'm again using my cup here. They do something because they really want to get better, and they've heard that this might work. And let's just say they have been in a history of some form of autoimmune illness or chronic pain. And what can occur is when you do too much and you try to hack the system, you can have more symptoms come up. Flares can happen. Things that have been in remission will come out. So it's really important to understand why we don't want to try to hack the system. We want to work with it, and I'll speak to this in a second, at learning how to restore base level regulation through connecting with the body in a much more gentle way, and learning how to reconnect with the environment through what we would call exploratory orienting. These are just two little elements to my work: reconnecting with the body, connecting with the somatic internal environment first, without trying to force it to do anything. What we're wanting to do is we're wanting to mimic We're wanting to mimic what didn't occur and what we wanted to have occurred when we were little. Now, I don't love the concept we're reparenting. And I don't love the concept of inner child work so much because those are a little elusive. But what I do like and what I've seen works is we're reteaching the system, you, the person, how to care for yourself in the way that maybe you weren't cared for by attuning to your body, learning how to touch and connect with your body in the way that, again, we want all babies to be touched with care, security, connection. We also want to teach you, the adult, how to connect with the environment and how to listen to your stress responses. So I'm going to give you an example. For those that have heard this example, pretend you're hearing it for the very first time ever. Okay. It's my stubbing your toe example. So if you've ever stubbed your toe or you've hit, I don't know why we call it the funny bone, the elbow on something, it hurts, right? Let's all be honest. It really hurts. In that moment, as simple as that is an entry to work with stored trauma. That is an entry point to work with restoring more regulation to your system. And here's why. How many, and actually, I'll get some chats in here. Let me have a little more to sip here. How many of you have done something like that and you ignore it? You just keep running through your home, doing your things, or you trip on the sidewalk and you're so bloody embarrassed that you pretend it didn't happen and you keep walking, but you're walking with a limp, and then you're not paying attention, and then you drop your purse, and then you run into someone and you're disoriented, right? I know we've all done that because I've done that too, right? But in that moment, that is, if you learn anything from today, this is it. The next time something like that occurs, your job is to pause, to feel your body connected with the ground, connect with the sensation. Maybe it's pain. Maybe it's an emotion of anger towards who put that coffee table there when you know that it was there all along. Maybe it is tears because you're so frustrated that you didn't see it. Maybe it's shame. Maybe it reminds you of something else that hurt like that. But what you'll feel is if you really tune in, your heart rate's going to spike a little bit. You might get redness to the area. That's an immune response, right? You don't have to see it, but these things are happening. Your breath, what do you think your breath might do? It might hold. And you notice that it does that. You don't change it because you want the system to experience the survival response. But then you, as the adult who has the higher brain and the cognition, because you've now learned this with Irene on September 14th, 2022, you go, oh, this is that thing she said. And I'm going to stand here. And of course, granted, it's safe to do so, right? I'm going to stand here or sit here, or I'm going to lay down, and I'm going to let my body do what it needs so that it comes down from the stress response. I'm using this with my fingers here. You've had a survival response. You're going to feel it. You're going to feel it. There's going to be maybe whatever. Maybe it's really subtle. And then you come down. And then when you feel that coming down, you look around. Okay, on with my day. As small as that may seem, that is reteaching your system how to be attuned to the physiology inside. And one of the key hallmarks of healing from the cluster of, and I'd be interested to know, there's probably many here who are in the midst of wanting to heal from some forms of chronic illness, chronic fatigue, autoimmune, migraines. We would call these syndromes in the body, which we know are connected to stored survival, fight, flight, and freeze. In order to really enter in and work with these things, which are a result, we know through the research, early trauma and adversity that hasn't been healed, we have to work with something called the interoception. It's a fancy word for the perception of our internal environment. And the reason why is because these internal organs of ours, they are the ones that produce sensation. The tightness in the chest when we stub our toe and it creates that tightness that we would say, I have a frog in my throat, or I have butterflies in my stomach, or I feel sick to my stomach, or all these things that we use and say as humans to depict what we're sensing inside. It is the biology. It is our biology talking to us. And so to heal a lot of these, we would call them conditions, expressions of stored trauma, we must connect with this body. And so imagine again this idea of trying to do a hack, but not understanding how to navigate the map and the language of internal sensation. It's super important. So again, someone might do a toning exercise, and I teach this in my bigger program, Smart Body, Smart Mind, but we don't do it until week 7 over a 12-week period, because we want you to build foundations. We want you to build the ability to even feel if there's a shift in the digestion, if there's a shift in the chest, if there's a shift or a tingle in the throat. But if you haven't taken the time to really learn how to listen, there might be something that shifts, but what do you think might happen? You'll miss it. And then you'll just keep toning and you'll keep doing the movement or the breath work, and you will completely skip over the nugget of information, which is the key to the entry to perhaps an old trauma that's been stored in the system for maybe your entire life, or maybe even the lives of your parents, because this stuff also connects to our ancestry, our generational trauma. So that stubbing toe example is a simple concept, but what I really want everyone to try and experience the next time something like that happens is how you can really slow down and be with it the way you would if your newborn baby just had an injury, right? You would tend, you would take care, you would listen, you would hold, you would do the things to help bring the system down. So yes, interoception, it's the internal perception of our internal environment. So here's another piece to this. I'm just going to go to my notes so that I don't forget anything. So when we're little, if our needs aren't met, and that, let's just say, I'll take it out of infancy and make it a little older for just to have a spread. Let's say you are 5 years old, and I'll give 2 examples. Let's say you're hungry, because you really are hungry, right? You've processed your food from the afternoon, and you've been playing or you've been doing something, and you're a growing kid, and you say to mom, I'm really hungry, I need a snack. And she says, you have to wait for dinner, and dinner is in like 2 hours. Or you're not hungry, you just ate, right? So first of all, I'm going to be really bold. As a parent, please don't do that. The chances are your kiddo is hungry. And it's the way that we, in some ways, manipulate and not listen to them that tunes them out. It takes them out of their interoception. They start to then go, okay, I guess I'm not hungry. Okay, I'll shut down a little bit. I'll make myself a little more less connected to my body because I'm actually feeling this intense need for food or blood sugar or protein or fat or whatever it might be, or water or hydration. And I'm going to shut down just a little bit. And over time, it shuts down, and it shuts down even more. So I say this because for some of us, it's very possible that we don't remember how and why our systems got so disconnected. But it can be these little tiny things that we will not remember right? We won't remember if when we fell off our bike for the first time when we were learning when we were 4, that we weren't allowed to lay there and cry because it hurt, and that we were scooped up by a frantic parent because they were so afraid. Or they said to us, "You're fine, just get up," when really you weren't fine. You were in pain. But because of this human brain of ours, this is the interesting part. It has the capacity to shut down sensation. We're just so intelligent that we also can do things that aren't good for us, right? And so another reason why we want to be careful about trying to hack and get a release of trauma or get an explosion of emotion or something like that is if we don't have this perception of our internal environment, it will be very difficult when you do that fancy technique to keep track of what's happening. And I would say 9 times out of 10, when I hear stories of folks who have had bad experiences with various techniques, even plant medicine is one that really can harm people, even therapy that isn't honoring the need for the person to take it slow and to move and all these things. All these things can usually, again, 9 times out of 10, the person will go into more activation. And then what do you think happens? Shut down. Fight, flight, freeze works in a hierarchical manner, and that if the fight can't express, so we'll give you an example. You're sitting in a therapist's office and they're asking you to do some sort of technique. And all of a sudden you feel a rise in your heart rate, but you're new and the therapist doesn't engage with curiosity with what you're feeling in your body. And you don't know that this rise in heart rate is important, but it keeps happening. But you kind of put it to the side because you're supposed to be doing this technique. The nervous system, the autonomic nervous system, will always be in charge if you're not listening to these reactions. So what often can occur, we have fight, we have flight, and then we have freeze. And then the system will go, he's not paying attention to me. I am giving you, him, her, whomever, a sympathetic fight flight response that says something isn't right and you are not doing anything about it. So we're going to put you into a shutdown. And so a person can then start to dissociate. They appear more calm, but what's actually happened is they've gone into a deeper survival response. So that's one thing that can occur without a person knowing it. And honestly, it's no fault often of the therapist because they often don't know these survival reactions in the biology. I don't know how many students of mine who are trained clinical counselors, social workers, psychologists, and I commend them for admitting that they actually had no idea about the nervous system because they were never taught about it, because really they just didn't know at that time when they were going to school. And they go, my goodness, I had no idea I was putting my clients into freeze or I was putting them into more activation, right? So we're all kind of in this together because we're learning about this stuff for the very first time, really in the last, say, 10 or so years. So I wanted to put that example because it doesn't have to be in a fancy retreat center or doing a big practice of breath work or cold plunging. It can be in a very safe environment with a therapist. And if they just don't know, and if you don't know, you're both in the same kind of game together and you're navigating all these survival energies in a very intricate way because humans have been designed to do that. So I wanted to give that example too. People might be curious, and I'm just going to answer it for those who maybe want to know about things like cold therapy, and it's become very popular. And I've done some videos on this concept of the cold, and it's typically dunking ourselves in baths of very cold ice water. So this process is very helpful and healing when the context is right. So back in the olden days, when you had a sprained ankle, what would they tell you to do? Ice. but contrast, ice, hot, or not hot, warm. And that was to help the circulation, right? To flush out the inflammation. And it does help. Just like if you have a bruise, you might put ice to calm the inflammation down. Now, the thing that's occurred with these ice bathing kind of this craze, I think what's occurring is a person is going into the bath, and this is in the context of someone who's dysregulated, because there's also a context for this when someone is regulated, and it can actually help with health, but we'll stick to the dysregulation. Let's just say someone knows they have a ton of trauma, they know they have these problems, and they've heard, do the ice bath thing, because that helps reset the nervous system. But here's what occurs. Again, if that person doesn't know how to sense their internal physiology, and they're already, I'll use my handy cup of water again, they have all this fight flight inside, they have a lot of freeze, keeping it all nicely tucked together. You put this into an ice bath, our brain will go, what do you think it'll go? I'm going to have a sip while I get some. What do you think is going to happen to the nervous system? Thank you. Someone said run. That might be the initial response, but then you're told you have to stay in there for 3 minutes. And so your brain overrides that and it stays. So yeah, there might be a run response. And often when a person comes in, if they're not trained to be with this, they'll have a panic. And then it's often the breath work is often connected with ice bathing. And so they'll bring that regulation, I say that with air quotes, in to help calm the system down. But what's occurring, again, in the context of someone who has severe dysregulation, they're managing their system's dysregulation. They're managing their system's dysregulation. Someone said, we're dying, shut down. So then there's this other thing that humans have called the dive reflex. It's what the big mammals and fishies in the ocean have that allows them to be deep in the water. You know how those deep water animals kind of survive without oxygen? Why do you think that is? It's because they're living in their nervous system is designed to be in a more shut down state. They don't need a lot of oxygen. And so we still have this part of our nervous system that can survive with very little oxygen. And so our system feels the cold, and evolutionary, it goes, oh, she's just dived into the ocean, the Pacific, and we better shut things down and bring everything into the core so that the internal organs don't shut down. And so this is a very crude example of the ice bath thing that's happening. Now, you can use these things intelligently, but I don't want to go into all the ifs, ands, or buts, other than to say you want to have some capacity to feel your body first. And it might be that you just start with feeling what it's like to even have lukewarm water on your body in a shower, right? Titrating. Because what is good when it comes to these, I don't even like to call it ice bath. I prefer the term hydrotherapy. Hydrotherapy can be wonderful for challenging the cardiovascular system a bit, but it's just little bits that we want to do. We do not want to start by plunking ourselves into 5 degrees Celsius water off the get-go. We want to inch into literally that kind of situation. So my sense is, for many folks, what's occurring is that their systems are going into shutdown, and they're managing that shutdown and that panic by the breath work that often comes with the ice bathing community. But again, like I said, for some, it might be very therapeutic when there is regulation on board already. So someone just said, I have a friend that asked me to go to a cold plunge with him, and it sounded very fun and helpful. Are you suggesting that if I'm currently dysregulated, it wouldn't be wise to go along? So again, you have to be smart with this. I think it's good to have outings where we're with people. And what would it be like if you just put your feet in it and felt that and stayed connected. If we aren't able to stay connected to our body and we're feeling a panic and we're having to breathe through it, then it's too much. That's kind of how I would say. You want to be able to stay connected because you can pass out, right? And this is why they'll say you have to be very careful, because if the circulation is being hit with so much force, the body will go, this is too much, and it'll pass you out. So very important to just, be with it, sense it, feel it, and have fun with it, but don't force yourself to do what maybe the next person is doing. It's like a yoga class, right? If someone's doing a handstand or a headstand next to you and you've never even considered that, you're not going to do that. And yet I know that happens sometimes in yoga classes and people push. So I'm just going to look to my notes and I'm going to go to the questions that we have here. I'm going to quote one of my teachers, Kathy Kane. Says, I don't know if any of you have heard of Kathy. She's one of my somatic experiencing colleagues. She and Peter Levine were kind of doing their thing. She's a little younger than Peter, but her work, while SE based, has really shifted to working with the deep physiology of the body. And so she said, I think this was maybe in one of our lectures, without changing the somatic system, in other words, the underlying neurochemical platform, any change in behavior is simply overriding through force of will. So without changing the somatic system, the underlying neurochemical platform, I'll explain what that means in a second, any change in behavior is simply overriding through force of will. So a lot of the biohacks involve behavior. They involve a shift of movement, a changing of the breath through conscious thought. Part of this work that I am not going to dive into too deeply today, but part of this work is very hard to explain in language, but I'll try, in that these neurochemical platforms, it is how the nervous system is wired to emit signals of danger, to emit signals of something's not right, mayday, mayday. But you don't walk around saying that, right? But you can see it in some folks that they have this vigilance in their eyes, right? You can really see that in someone that has that kind of look of shock or shut down, the posture of shame. It's in the somatic physiology. It's in the organs. The gut is like our first brain as a baby. This is why the gut gets hit so badly when we're stressed, right? Have you ever had your gut get all funny and, funny whenever there's a more stressful event? Or maybe for some of you, you have a more gut-related syndrome like Crohn's or IBS. These things are connected to this regulation. So we need to get, I'm using my hands like under the behavior and into the somatic physiology and start to listen to it so that we can shift. And this is why that example, again, as simple as it is, start to notice how you feel your body when it is under stress or when it has an extra stressor. Okay. I wanted to read that because it's just so good. So to wrap up, before I get into questions, this idea of the biohack, I understand why we want it, because we really want to be better like yesterday. And so we want that quick fix. Sometimes a quick fix might be useful. For instance, and I use this example all the time, if you have a true infection, like something that really does probably need medical attention, like an antibiotic. I don't love them, but sometimes they come in handy. That is a hack. It's something that will take care of something in the moment. You don't keep taking it for 5 years. It's for maybe 10 days or 6 days or 2 weeks. Then it's done. But then you have to recover your body after that, as we now know. So that is a very specific place where there might be a need for a quick hack. But when it comes to this, I call it the human condition, that so many of us have been born into without proper regulation, without being taught how to be in our bodies. And culture has done this to us. It's not just through lack of attentive parenting. For some of us, we did get that. But the school system, right? The push to go, the fast-paced life, it also denies us being in our body. So because of this lack of connection, safety, regulation, rather than hacking in and trying to fix the system from the outside in, we really want to regulate it and grow capacity from the inside out. You could never say to a newborn baby who's crying and fussing and is not well for some reason, I need you to take 10 deep breaths, please. It's kind of a joke, but it's true. You can't do that to a newborn baby. You can't ask them to make a sound. But what you can do is you can connect with them. You can calm your breathing as the primary caregiver. You can engage with them. You can hold them maybe a little more securely and pat their bodies and stimulate to let their spinal system and their nervous system know, oh, I'm okay, I'm safe. And then through that, they might have a spontaneous breath. You see? But the spontaneous breath isn't happening because we're telling them to take a breath. The system wants to reset in those moments of intense activation. The baby needs to learn how through the provider. Us as adults, we don't have that mama or that papa or that caregiver doing that with us, but we can reteach it to ourselves. So that is the portion of lecture that I wanted to get to. I'm going to get to some questions here. And what I will say too, if someone doesn't have yet the skill to be with their sensation and connect when they are feeling a stubbed toe in the pain, then by all means, take some deep breaths. If someone is feeling a need or a desire, a fight response to hit their kid and be abusive, and they know that they're trying to change this stuff, then by all means, take a deep breath. Do something to come out of that response, right? So there's nuance here. Sometimes we might need to override and figure out how to be with our body with some of our techniques and tips and tricks and biohacks. But I'm looking bigger picture here so that we're not having to always do these hacks and these techniques to keep ourselves connected. So someone asked, I'm going to bring my screen over here. What if I already hacked and now I'm so overactivated? What do I do? So this is maybe something that many of you have experienced, and it comes down to, and this kind of brings into where I'll talk a bit about my curriculum that I teach. It comes down to the ABCs and the 1, 2, 3s of nervous system health and healing. So let's just say this happened. There might need to be a time period where what you're doing seems really basic and simple, but it's trying to reestablish some connection to the ground. So the sort of 4 basics that I teach in these contexts, like we are right here, right now, in this public call, one would be, can you sense the body against the thing that you're standing on or the chair that you're sitting on? So everyone can try that right now. Maybe you're already noticing that, or maybe you haven't felt that connection the past hour that I've been talking, and it just came into your awareness. Oh yeah, this is my body against the ground. So again, when we get overactivated, we're losing ourselves from the present moment. We are in nervous system arousal. And one way to help tether us and bring us back to land our ship back onto planet here is to physically, and you might even say, I'm going to feel my feet on the ground. There they are. You might even need to look at them and move them a little bit. Movement sometimes is important so that you feel that sensory activation against the skin receptors. Overactivation also means that we might be one of two things. We might be more hypervigilant with the world around us, or we might be feeling too much inside. So again, it depends on the person, but we may need to reconnect with the environment, something called orienting, and actually saying out loud, I'm here in this home, I'm seeing this thing and this thing, and actively engaging with the environment. And then the other elements that are a little more advanced are actually working with the stress organs, working with the gut, the brainstem. So these are elements that I teach in Smart Body, Smart Mind, where I am guiding you through recordings, but through these exercises. I call them neurosensory exercises, where I am teaching you how to focus your intention on these organs that go into stress response and hyperarousal. And we're basically doing what I would do if I was in private session with you, but you're doing it for yourself. So again, activation in the system, we would treat it no different than someone who already was, let's say, in a severe state of dysregulation. And then the other thing is the fancy word titration. Titration, which means little tiny bits of work. So again, I'm going to take my trusty glass of water. And I'm not going to do this, but say there's all this stress in the body, all these fight, flight, freeze responses. I am not going to pour this out in one go, but I can take a little bit of water and drop it out. So another part of working on overactivation is we might need to start with little tiny experiments of feeling the tightness, let's just say, in the chest. I'm just making this up. And I might get a person to sense that in context of these lessons. And then we teach them, okay, that's enough. Now I want you to resource and see the world outside of you. Or now I want you to get up and just completely forget about this. It's not about ignoring it, but it's shifting the attention somewhere else. So these things happen and we can come out and down of them. But again, it's about building up the foundation that was maybe not there to begin with. Right? So in some ways, going back to the roots. How do we go, next question, how do we go from tuning into that nugget of information of the change in the sensation to using it as a key to unlock a past trauma? Time. I'm going to read something, see if I can find it and see it without my reading glasses. This was a comment from someone on one of our videos this week where I broke down why I believe Smart Body, Smart Mind, again, this is my 12-week course, has stood the test of time. It's been about 7 years that we've been doing this program, and this round coming up next week will be the 12th time we've done it. And so this person said, I've just completed my first round of Smart Body, Smart Mind. So they must have started it in March. And it has taken all this time to really get Irene's point about why the trauma release isn't important and growing capacity is. I'm paraphrasing a little bit here. That's what I was expecting. So they were expecting to just get the trauma out. And that's because that's what I was familiar with. I was familiar with, we have to release the trauma. So at the start of the course, I almost bullied my poor system to release things or to feel things or remember stuff. My aha moment has at last arrived as I'm looking forward to doing more of this and just focus on building up the capacity and the regulation. So oddly, and trust me when I say these past traumas, they will come out. But they'll only come out, and they'll come out organically and easily when we do build up this capacity to be in our body, to sense it, and to experience from this moment forward the stressors that we experience. Because we can't excavate something that is huge when we don't have the tools in our physiology to process that big energy. Does that make sense? The system will not it will not give you that big old trauma if it knows she can't even cry when she watches a commercial, right? The tears come and she suppresses them immediately. That's not good. There's no way we're going to be able to get this big thing out if the system isn't ready for it. Now, there's situations where some people might unlock a past trauma. This is when we use maybe the term flashbacks, if you've heard that term, where an event comes back so full force and it re-traumatizes us and it's intense. That can also happen. But in my experience, for the most part, when we can really work with these small pieces, it lays the foundation so that we can do bigger pieces much more easily. It comes back to that example I gave at the very beginning about summiting Everest, right? You would need to start first walking every day, and then stair climbing, and then lifting weights, and then all these things to build up the physiology so that you could summit that mountain, but you need to build up the system. If the body is complete, next question, if the body is completely shut down and numbed out, how can we work with it? How can we work with it? Does your program help to come out of those states? 100%. 100%. That is how it has been designed. That's how the program has been cultivated and curated, is to, again, gently, methodically. The work can actually be a little boring sometimes. I'm going to be really honest, because you're doing things that are very basic over and over again. But again, I'm going to come back to the kiddo example. If you've ever raised a child and they're learning something, you sometimes go bonkers because of the repetition. They have to repeat over and over again, right? And you just have to stay present with that over and over again. So coming out of shutdown and out of freeze, it takes time, but yes, it is exactly what we work with in the program. Next question. I'm not sure if I'm reading this right, but I'm going to say it out and I'm going to try to figure it out. So someone asked, in a regulated system, is it like stimulating rest and digest? So rest and digest is a portion of our parasympathetic nervous system. So I mentioned that vagus nerve. The vagus nerve is more than just freeze, and it's more than just social engagement. It's also what goes to our gut and all the organs below our diaphragm, essentially. And so when we have regulation, there is good balance between what we would call sympathetic nervous system physiology and parasympathetic nervous system physiology. And when we rest, when we're chilling, when we're sleeping, when we're reading a book, we want our system to go into the gear of rest digest so that we recoup and regenerate. But the problem that happens is if we are stuck in fight, flight all the time, and also parasympathetic vagus nervous system shutdown, for stuck in these fight, flight, freeze, the nervous system is being co-opted for survival. And so it will not rejuvenate and repair your cells at the gut level, the artery level, the muscular level, all these levels. And that's why when someone has had lots of early adversity, they can get sick because the system is not recovering, it's not repairing. This is where immune dysfunction comes in. This is where nerve degeneration comes in. It's this lack of this ability to really clean the cells and keep the cells healthy. Question. How do you know when you're regulated enough to release a major trauma? I have done it all backwards, but nothing was available at the time. Great question. As I mentioned in the question above, or the answer to the question above, it takes some trial and error. But what starts to happen as you start to get more capacity on board, as you start to really tune into your body in the present moment, less worried about the past stuff, that capacity builds and you start to have this sneaky sort of sixth sense, which actually comes from your gut, that goes, I think Irene's got this. I think it's time to have that dream about the thing that happened when I was 6 that was really, really terrifying. But you don't go to bed saying, okay, tonight well, you could, I guess, but usually you don't go to bed saying, I'm going to have that night terror tonight that is going to help me process this bad thing that happened to me when I was 6. The body will start to know. The body will start to know, okay, it's time. I can speak to this quite acutely because right now I'm moving through some very old, I believe it's old shock traumas to my pelvis from when I was a figure skater on ice and skier for like 20 years of my life. Never once when I fell on the ice, which was probably more than 1,000 plus times, did I ever cry, feel sore, or get any body work done. You just suck it up and you keep going. So for whatever reason, the last 2 weeks, my body was like, okay, you're ready to feel this pain that you've never felt ever in your pelvis. And so that's moving through me. And yet I'm able to still be here and think and compute and be in capacity. So the interesting thing is as regulation builds, a weird thing occurs is that you will then experience the bigger things that you never felt. And what can sometimes happen is a person might think that they're going backwards, right? Because why am I feeling all this pain or all this anxiety, or why am I having this night terror? I've been doing all this good work. It doesn't make sense. My digestion's better. My immune system is better. I can think clearly. And how come I'm having these things come up? And often it's not a sign of backwards regression. It's a sign that you have more capacity to be with the stuff that you certainly couldn't when you were younger and you didn't have this skill set on board. Does that make sense? Because I have had folks who have been like, oh goodness, this must not be working because I'm feeling more. And the thing is you will feel more as you go through this work. How do you tell that you have sufficient regulation already to do cold therapy? I love sea swimming and I can manage more physical activity in the cold water. You really just it has to be trial and error. So if you come out of the water and you're like this, like shaking, it's too much. So when you're in the water, you want to be enjoying it. If you're in that water and you're like, all you can think about is getting out, then it's too much. My husband and I were at a lake in the BC interior this summer, Kootenay Lake, I think it was called. I don't know when I last was in something so cold. I didn't think it was going to be that cold. And it was literally dive in, get me the heck out of here, out. I wasn't going to be a hero. I'm like, if I stay in here for more than a minute, I might go into hypothermia. It was that cold because we hadn't had much of a summer. And we both looked at each other. But it comes down to feeling your body. If someone is functionally frozen, they might not feel that as cold, right? And so that's where you have to be careful. So feeling into it, titrating, being smart, experimenting, and then basically, if your system feels better for the rest of the day and your digestion is good, and then it's a sign that it's probably okay. But if something flips in your physiology and your digestion goes wonky, or you can't sleep that night or something like that, then chances are it's maybe too much. Someone just asked about Joe Dispenza's work and if it's overriding. I haven't done any of his work personally, but I've heard that yes, it's possible that what's going on there is a lot of overriding. And what I've seen, and my husband and I have talked about this a little bit, is you will hear miraculous stories. And I have no doubt that in that moment of connection in that room, and there's all this group field, because we do know that energetically we can help someone heal with the power of intention. There's a lot of research, more research in that than in my line of work, that has shown that the power of intention, prayer, can really shift things, for example. So my hunch is that there is a field created in that energetic that is shifting a person's system to be able to walk again, to get rid of a pain, whatever it might be, My curiosity would be what's happening with that person after. Have they built the foundation so that they can keep that massive shift in their physiology? Because a shift in the physiology is just a shift in the physiology. It doesn't necessarily mean that they've restored regulation to the entire rubric of their autonomic nervous system. And that's the part that I can't answer. It really depends on the person, I think. Question: how would it affect the baby's ability to self-regulate if the parents used putting the baby under the cold water to stop it from crying? That's not something I've ever heard before. How would it affect the baby? Okay. So if a baby is being put under cold water to stop it from crying, it's essentially being taught to go into a shutdown. They're being frightened with a massive state change of their physiology, and the system is going into survival mode. It's feeling the receptors on the skin, the blood in the veins are, the signal is very quick, especially in a baby. They're so sensitive. So the moment they feel that water, their autonomic system is going, Mayday, Mayday, we need to shut down. And of course, they're going to stop crying. It reminds me of, what time are we at? I'll go a little bit longer, you guys. There was a video that went quite viral a little while ago of a gentleman oming to his baby that was crying, that sound that you would do in yoga. And there's nothing wrong with that sound, but it frustrated me because if you really looked at that baby, you could see the baby's eyes went into a bit of shock, and then she stopped crying. And so he was congratulated, and everyone was like, what a hero, because he just figured out how to stop his baby crying. But there was no connection. There was no, it was forcing a sound onto her. She's feeling it. It's frightening her little system. And so she stopped crying, right? So again, that's a great example of a hack. Yes, it hacked her system to shut down, but it's not teaching her how to feel connection, how to be with another human and feel safe. In that moment, she's feeling unsafe by this big baritone sound. So yeah, that was hard to see when I saw that. Question: so as a therapist, we probably wouldn't hug or comfort them. Would the main thing be then to suggest to clients is to gain more awareness about their body and sensations? Partially, yeah. So there's nothing wrong, in my opinion, and I know some lines of psychology you're actually not allowed to touch your patient due to regulations, but touch can be useful if it's very intentional. I used touch when I was in private practice, but it was intentional. It wasn't so much to soothe them, but to bring attention to their own body. And then I would ask questions about what they sense. But I also know that in some therapeutic situations, there can be a codependency that's built, and that person isn't learning how to self-soothe on their own. So it really depends on the context. Question: is it possible to be too dysregulated to do the SBSM program? Yeah, it is. So I'll speak quite frankly to that. Because it is self-directed, it's not one-on-one therapy. We're not doing group calls where we're talking and I'm guiding you through things. It's self-study, it's adult learning. You do need to be able to show up a little bit and do the work self-directed, self-initiated. We do have a forum in our site where you can ask questions of my team, and they're all trained in somatic experiencing. All of them are trained in Kathy Kane's work, and many of them are trained in the Feldenkrais method or some form of somatic movement therapy. So we have great support, and they're not there to be there with you every single moment. I'll be very honest there. They're there to help you understand the lessons and what you might be feeling in them. And so, yeah, we have had people who realize when they get into the work, I think I need someone one-on-one. There's just too much chaos and dysregulation. That being said, we've also had people who have come in with severe dysregulation and complex PTSD. and they do okay. So it depends on your learning style. It depends on really your gut. You got to go with your gut impulse with this. And also, we do have, it's more formality, but we do have a refund policy. So after the first 4 weeks, if you're like, this isn't working for me, I can see that the program is useful for many people, but it's just not right for me, maybe at this moment, then we'll refund you your money. There's no need to continue if it's not helping you. If you trigger a trauma, question, if you trigger a trauma that you don't have the capacity to process, do you always re-traumatize? Or is it possible in that case, we release only a little bit of trauma? No, you do not always re-traumatize. Re-traumatization typically happens when our capacity isn't big enough to feel and sense and be with maybe the memory, the thoughts of what's coming up and out. So it depends, of course, on you, the person, where your capacity is. The goal, again, for us, nowhere within Smart Body, Smart Mind do we ask you what your traumas are. Never, ever, ever, ever. There's no worksheet that's getting you to write out all the bad things that happened to you. We don't go in that way. We work at capacity building. If you want to share what occurred to you and your history in our introduction worlds where you guys are introducing yourselves to others in our forums, then you are welcome to share as much as you wish. Or when you have a question from one of our team, you might say, I had this surgical trauma when I was 5, blah, 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 blah. So again, I just wanted to mention that. And the key is that we're just trying to do little bits. But again, I'm going to sound like a broken record. I'll come back to the toe stubbing thing, that example. So simple, but when we can do more of that present day. So think about this from this day forward, every time there's a stressful thing that occurs, anytime you hurt yourself or there's something that activates you, by being with that now, you're creating capacity in your system and you're learning how to better be with your body so that you can process those big traumas. Question, what if a person cannot feel their feet at that point? So I think you were talking about when I mentioned, can you connect to the feet? So this is common. So we might suggest, if there's very few lessons where we actually physically work with, say, the feet, but I might say, can you touch them? Right? Can you feel them with your own hands? If you're walking, can you feel that you're not falling over? I know that seems really simple, but it's like, yeah, it's like, well, these are your feet. And sometimes a direct connection to sensation isn't the way in, it's a thought. It's like, wow, yeah, I am standing up. So my feet must be supporting me. So there's kind of these interesting ways that we can, and again, with the help of our team, help you find entry points that are less direct and maybe asking the question a little differently so that you can feel and connect to something or sense them in a different way. Can you give a bit more information about how taking Smart Body, Smart Mind has different outcomes, like if one would only, say, do somatic experiencing work? Yeah, that's a great question. So just a reminder, I'm trained in somatic experiencing, but I'm also trained in somatic practice, which is Kathy Kane's work, which works with the stress organ levels in a very different way than one would work with someone if they only had the somatic experiencing lens. So I have those two things under my belt. But then the other thing that I feel makes SBSM unique is my background in movement. It's my background in the Feldenkrais method at a very high level. And so all of the audio exercises that you do are taught from this Feldenkraisian point of view. And Feldenkrais was a person, he's long passed, but he was considered the grandpa, the first person who really put neuroplastic healing on the map. And that's truth. He was healing people that had stroke back in the 40s and 30s before it was even known that you could heal from neurological damages. So the difference is that we're not just teaching you how to track sensation and maybe sense activation. We're engaging you to use your body and learn how to also move your body and be with your body in a very intentional and very aware manner. Because again, the body is what is keeping these stored traumatic responses. It's not just in the nervous system per se, it's in the posture, it's in how we use our spine, our hips, our pelvis, our eyes, our head, how we hear. And so that is a big difference. And just to give a little anecdote, more than half of my moderators, who are the professionals who help me with this program, I didn't find them. They found me because they went and did Smart Body, Smart Mind, as well as also having been SE practitioners because they were curious. Because remember, I started this back in 2013, 14, the first renditions of what is now SBSM. And what they found was that they actually, and some of the newer SE practitioners, they actually understood SE better by going through Smart Body, Smart Mind. And I'm not saying that to just give myself props. It was true because in the SE training, there is no time to teach the practitioners in training how to be in their body. Cat's out of the bag. There's no time. There is no training to teach the practitioners how to be in their body. So what sometimes occurs, and this is why sometimes people have bad experiences with SE providers, is those providers weren't embodied, and they learned the theory and they're trying to apply the theory and not the whole process of being connected with a human and watching their survival physiology and all those things. So very much of the same, but also different SE compared to Smart Body, Smart Mind. Just reading through your questions here, you guys. Should we always be aware of our connection to the ground or surface when we are on it, or can that sense come and go? Yeah, it can definitely come and go. What would a regulated person experience? So a regulated person will experience flow. And so flow might mean that this awareness of the body in space, it's there, and then it's out to the world, and then it comes back, and then it's thinking, and then it's eating, and then, oh, there are my feet. So it's not always absolute, but it's moving. There's like this moving system that we're wanting to have awareness of. Can this nervous system work apply for people who are neurodivergent? 100%. Sensitivities, neurodivergence. We see all people as people, and everybody has a nervous system, and it's all about growing capacity, and how that person grows capacity is for them to play with and work with and trial and error with. And so 100%. Someone had a question about hypnosis. I'm not very well versed in the powers of hypnosis, other than to say I know that it can be very powerful, because it is going more into that subconscious part of the brain. Someone asked, I've noticed my capacity to process stuff is much bigger and healing has lasted. That's wonderful. So in the case of, again, this is where you have to trial and error. And for some people, there might be some things that work really well. And for some, they might not work so well. So is hypnosis a biohack? Personally, I don't, my gut doesn't believe that it is, because it's a much bigger process than just trying to apply a technique, because you, the person going under hypnosis, is having to really be engaged and involved. I also know that there's some people out there that can't be hypnotized. And I think that is fascinating. I think that might be a sign of some form of dysregulation and freeze, where that person's like, no one's coming into my mind, right? I want to stay alert and have no surprises. Someone said, my body appears to be reacting during this talk. Hard to get a big breath at times, and now I'm getting some hives on my back. What is up with that? Is this my subconscious reacting to the thoughts of past traumas? This happens. So this information, while it's education, and my embodiment of this education has a weird way of moving into people's systems quite easily. And so because of our higher brain, and because we have the capacity to process words and language, and then it comes into our system. So it can be very probable sometimes that you'll feel a reaction. And so my sense is what is happening is your system, your autonomic nervous system is going into an activation. And so I would actually say, if you're still here, to be with that, but to maybe pause this recording. It's not a recording now, but to pause and to move away and to resource yourself in a way that can bring you back to the current moment, and feel. Can you sense what's happening with this immune response on your back, which is what hives are, and don't try to force the breath. What would it be like to connect and just see the world around you, to sense your feet on the ground, and to not try to force the breath? But yes, this is very, very common. Is a constant migraine and neck pain for years a sign of freeze? It can be. It could also be an old trauma, concussions, whiplash that's coming up and out. Migraines are often clustered into what we would call syndromal representations. In our line of work, that would be chronic fatigue, chronic pain, fibromyalgia, even autoimmune conditions, where the system is cycling quite quickly between high fight, flight, and freeze. And so the blood vessels that are going to the brain are kind of in a bit of a chaotic dance, and that's what creates that pain, and also the pain in the neck, because there's a lot of blood and a lot of pathways in this upper part of our body. Of course, the brain stem is there. So pain can be many things. Of course, if there's an injury, that can be painful, but it also can be trapped sensation. So pain is often trapped sensation that we are not connected to. So that is one explanation for those things. Okay, let me get through a few more. Where'd I go? To stick on the biohacking topic, is microdosing a new trend as a quick fix? So this is the practice of taking small amounts of, say, psilocybin, DMT, I'm losing track of some of the other things, ayahuasca. A lot of these plant medicines are getting hot and popular. It all depends on the person, right? So again, it comes back to what is occurring in that person's physiology, not just during, but after. Is there an integration occurring? So again, I am seeing that it is being used as a quick fix because, again, people want to get on the other side quickly. But I also know that some of the, and microdosing is different than, say, like a 10-day ayahuasca retreat in the jungle. But I do know through the grapevine, because I know a lot of people in these worlds, that sometimes these things don't go very well. And they often, not often, but there's been many cases where suicide occurs in these retreats because the system was so small of incapacity. And then you offer it this intelligent plant medicine that is of the earth. The earth doesn't know that the humans here on earth are dysregulated. See that? The medicine that's growing out of the earth is very pure and very potent. And it doesn't know the difference between dysregulation and non-dysregulation. So if someone is taking something, even if it's a microdose, and if they're not ready for what they're going to feel, it can be really intense. So for some people, there have been instances, and I know people who have had amazing responses, but all the people that I know who have had amazing responses had already done a lot of pre-work, a lot of foundational work. They knew how to stay tethered in their body and stay in the present moment. Okay. You've spoken a lot about functional freeze, and I was wondering how this work might look different for someone who has more hyperarousal and fight flight. It's still very similar. So again, when we go into this work, we're not asking you to classify yourselves. I'm this, I'm that. We actually all go through the same curriculum. And it's designed in a very strategic way so that it builds over time. And that's why we have our moderators there to help answer questions. Because for some of us, learning how to orient and see the world around us, whether you're in functional freeze or hyperarousal, it might be so lovely to be brought into the environment and see it. And then for some, it might be terrifying to see the world and bring our intention into it. And whether that happens in someone who's functionally frozen or hyper aroused, we really don't know. Someone who's hyper aroused might not want to see the environment, but someone who's hyper aroused might actually realize they've never even seen the environment. And so you see there's all these little distinctions here that you will learn and find as you go through the work. What do you think about I like this one. What do you think about the law of attraction, manifestation, and positive thinking, etc.? Yeah, whatever happened to all those things? You notice how the law of attraction work and that has kind of left the building a little bit in the healing worlds, like it's still there. So the interesting thing about this stuff is that it does work, but it tends to, from my experience, not stick very well when we aren't connected to our body, because our body, our organs, it's connected to our capacity to put out that information to the world. And the more solid we are, the better we are at manifesting, the better we are at staying on track with things, the better we are at attracting things that we want. Whereas when we're dysregulated and making these affirmations, the signal isn't as clean. That makes sense. It is a little wonky. And it could be that maybe what we're asking for isn't even accurate because it's being done through a state of dysregulation. That makes sense? As opposed to a state of, this is really what my body wants, not so much, this is what I think I want. So there's an interesting thing that occurs when more regulation gets on board. People really start to find that their lives shift in positive ways without them having to think about it. And that's kind of what's cool. This is someone I think in response to the person who mentioned that they were having a bit of a reaction. So thank you for this. And thanks, Bonnie, for pointing this out. This person said, my nervous system was activated after the first 2 days of Irene's class over the weekend called The Essentials. And then I finally got regulated and calmed down. Thank you so much. Yeah, so thank you. Sometimes our activation response has to pop up because, again, my glass is getting less liquid in it, but if there's lots of stuff in here, we got to take it out. And when we take it out, and we start to feel what's in there, it's going to feel a little messy, right? And so that's the part of this work. It's not just about calming down. It's about feeling the activation and the survival responses that have been stuck in us for so long. And that can be a little disorienting when it first starts to occur. How is the Alexander technique similar to somatic experiencing? It isn't. They're very, very two different technologies. Alexander is more of a technique. It's more postural, whereas SE, in its truest sense, in the way Peter teaches it and the way he would work with someone, is honest to God more shamanic than a technique or a method. It is really this dance between a person's nervous system and the practitioner and helping a person discover their organic intelligence and their healing. Nothing wrong with some techniques for posture and movement. Going to the gym is very structural, but it is not somatic experiencing. Last question, because I'm feeling the need to follow my impulse and go to the bathroom. So the last question here is, I haven't completed the 21-day nervous system tune-up. So this is my self-study starter course. Would you recommend to take SBSM if I haven't completed the 21 days? Absolutely. So the 21 days was done and created after I created Smart Body, Smart Mind. Smart Body, Smart Mind was really designed to bring all the big pieces into one: the Feldenkrais work, the somatic experiencing work, and the theory, as well as the somatic practice, working with the stress organs, working with the gut, the brainstem, the body, the joints, the movements, the senses. So the 21 days is still wonderful, but it does not get into these organs. It doesn't get into working with healthy aggression. We don't tap into the differences between healthy and toxic shame. There's just a lot more robustness and more volume to the lessons because we have more time. And then often what our SBSM students do is when they want to break a little bit and they want to come back to some basics, they'll go back to the 21 days and they'll review it. So as someone who joins Smart Body, Smart Mind, you also get the 21 days as part of the curriculum for SBSM. So that's a little perk there. So I hope all of you who are still here, and of course, those listening to the recording, thanks for hanging out, have learned at least one thing, hopefully 4 or 5 things. And if you've been feeling a little activated, just be with it. See if you can be with the activation and not be afraid of the activation. That's one of the biggest things, is how can we be with our fear and not be afraid of it? Because fear is very important, but we weren't taught, right? We weren't taught how to be with it. On this topic of biohacking, I hope I've shed some light onto why I don't love it for this stuff, especially when we have been dysregulated and we know we didn't get that good, yummy, safe nurturing when we were little ones, and super common, right? So it's just part of the human collective, is so many of us didn't get that. So you're not alone if you didn't get that. As I've mentioned, we've got registration for Smart Body, Smart Mind right now. I didn't go through all the details of SBSM. If this is new to you, please go to our site. It's just smartbodysmartmind.com. It's also on my website. We'll pop it into the chat if Bonnie hasn't already. Read through the program syllabus. Learn about what you get, the details, the features. And I would really encourage people to see and read the stories of our alumni, because they're pretty cool. And a very common theme in the stories is, I've been having this trouble XYZ for decades. I've tried everything, and this was the one thing that helped. Again, I am not a miracle worker. It's just because we're bringing together these really cool practices. And then my art form is bringing them all together for you guys to relearn how to be in your bodies. I mentioned at the top, I'll be doing more calls this week. So again, all that information is on my site under live events. It's the same Zoom link. You're all the more than welcome to come and learn and ask questions. I think the chats with the alumni are going to be really fun. So definitely come and check those out and hear their stories. And then the final thing I'll say, be very proud that you're here and be very aware that this is really the first time in history, collectively in these small groups, we're learning about this depth of nervous system understanding. It's really quite fascinating if you really look at it and feel into it. And I think this is why, I know this is why this idea of healing trauma, working with the nervous system, has gotten so popular. And we want to make sure we're doing it the right way, and we're not overloading the system, and we're going slow and all these things. So thank you so much for everyone here, your attention, your focus, your energy. And remember, the next time you stub your toe or do something like that, you know your homework, practice it. Let us know how that goes. Thanks, Bonnie, for popping in questions so I can see them easily. That was very helpful. And thank you, everyone, for being here today. And as I said, the recording will get popped up on YouTube in a little bit after we process the call. All right. Be well, everyone.